Good afternoon, everyone. It's Wynn Brown with Heywood Healthcare's update for Friday, the 1st of October. First, just jumping right to our COVID information. We have tested 103,000 specimens over the course of this pandemic with 4,886 results positive. Our cumulative rate throughout the pandemic is 4.8% positivity, almost double the state at 2.81, and our 7-day average, this is what's really concerning, is 9.12% positive rate. I don't know if we've ever had a 9% plus positive rate, and it's an increase of 2.11% over the prior week. So the state is only at 1.97. So think about that. We're at 9% and the state is essentially at 2%. So we have definitely an amazing surge going on. Our inpatient census is 8. We have a chart that's embedded with today's report that shows that we are still in the red zone. Looking at incidents now above 40 per 100,000 in our region. Athol is the highest at almost at 74, and Ashburnham the lowest at 20. So take a look at that. It's very concerning. A lot of disease in our community and infection rate, and so we really need to make sure that you're doing all those things I talk about every single time, from washing your hands to wearing your face mask to socially distanced to getting vaccinated. Again, almost all of this is completely avoidable if we had everyone get vaccinated. So for those of you out there who think it doesn't need to be done, it does. And the reason we have the issue is that you're not getting it done. So enough of that, get it done. We did have an exciting afternoon yesterday, fun afternoon in Orange, where we cut the ribbon on our new Millers River Primary Care, which is located at 30 East Main Street in Orange, and it looks great. There's some pictures embedded here. It's the old TD building, and it is gorgeous inside, and we're very excited about that. So if you are interested in being part of that practice, you can call the number and get connected to us there. We do have a temporary closure that started yesterday with our mental health unit, this happened earlier in the pandemic when we had trouble with staffing, so we had to close that unit because we just couldn't function it. And we hope that we can bring that back as soon as we can get the staffing right. But if you look around the Commonwealth and around the country, behavioral health units are struggling just like every other, but maybe more for staffing. So we'll look at when we can reopen that. Just to remember that we do have our vaccine mandate became live today. So if you had not had your second dose, then you were not able to work. We are giving a little extension for some people who are struggling to get that scheduled. But it resulted in a job separation rate for us of less than 1% of our total workforce. So we appreciate everybody who's coming to work for us, but we lost a total of 13 employees to the vaccine mandate, and we have about 1,600 employees. So pretty small rate of people who did not comply. Also, just to our staff, we have a new referral bonus program that goes live this month, a $500 employee referral for each employee referred to us who comes to work for us. You can check on the Human Resources intranet page for that, and there'll be emails coming out as well. And just a reminder to everybody who has a window air conditioning unit that will be removed in the next couple of weeks. So just be on the lookout for that. I know some people like to have small space heaters depending on which building they are in and how the HVAC works. Do not bring your own in. Contact facilities. They have approved units that can be put in rooms, so please do that. And please save the date. We have two events coming up. Obviously, this Monday is the Athol Golf Tournament. We have the Ride for Your Life Suicide Prevention Ride and the Healthy Harvest 5K on the 23rd of October. We hope to see you all there. You can get online and register for those as we continue our journey to be one of the best community-owned health systems in America. Thank you.